guys. Welcome to this webinar. I'll be asking in between a few questions, but you can answer on the chat. I just want to know how much you are aware about topic today, that is hepatitis. This is only basically to make you aware of the condition, and it is a community problem. It is a general problem, and as we go through the webinar, you'll come to know why it is so important. As we go, we'll come to know what are the types of hepatitis. We'll say what are the causes of hepatitis, how we can prevent them, what is the treatment, what are the investigations that are available, and what as a person, individual, and as a community we should be doing. Okay, this year's the theme for Hepatitis Day is it is time for action. The time for action at the individual level might be at state level, it might be at the community level, it might be at the country level. And overall, globally, it is time for action as the number of cases are increasing. When we talk about hepatitis, I'm sure the only thing that comes to your mind is jaundice. Is there anything that comes to your mind other than hepatitis when you say hepatitis? Now, coming to hepatitis, it is it has got very huge implications throughout the world, especially in middle and low income countries and developing countries. Even though India is the fifth economic power of the world, we are still developing, and it is a huge problem in India, especially among rural population and also in urban population. Now, the type of hepatitis, it varies in urban and rural population. That is why this topic is very important. Now, coming to global scenario, an estimated 1.3 million people died from chronic viral hepatitis B and C. Now, the chronic viral hepatitis is caused by only B and C types of hepatitis and not other hepatitis. Now, we have seen around 3,500 deaths per day. An estimated 254 million people are living, and every year around 3,500 deaths we are seeing. But when we come to India, whatever the latest estimates are, they are around 2021 to 22. Around 40 million people are chronically infected with hepatitis B and 6 million for hepatitis C. Now, this is the global map that you can see. The number of cases that were there at a point in time, that is 2022, around the world. Now, when you look at India, if you take all the kinds of hepatitis, that is hepatitis A to E, even though we are not at highest, but we are moderately high. That is around 2 to 7%. When we understand this, hepatitis A or any kind of hepatitis, once it is infected, the antibodies remain in your body throughout. So when these kind of studies are done, they will see that how many people have these antibodies. That is why the amount of people that are there in our country are highest, and when you look at the denominator, the percentage is very high. So viral hepatitis, hepa is basically means liver. Itis is basically inflammation of liver due to an infection. The infection is caused by all kinds of hepatitis virus. Now, the term jaundice is basically a French terminology by the name of jaundice, and clinicians used another term called icterus. That is, when you see a yellow eye, it is called icterus. Now, that is derived from Greek. And jaundice, you are all aware. If there is jaundice, your parents will be telling you that you need to have some kind of restrictions and all kinds of things. Now, hepatitis is not just caused by any kind of virus, but also it can be caused by drugs and also alcohol related and other toxins. Now, as you can see, there are 5 kinds of hepatitis: A, B, C, D, and E. Now, why there are so many types? The symptoms may be similar, but the route of transmission is different. Hepatitis A and E have a similar kinds of transmission. Hepatitis B, C, and D have different kinds of transmission. Hepatitis A is through fecal-oral route. When we say fecal-oral route, it is basically a person who is already having hepatitis. He is passing hepatitis A virus into his stools, and because of mixture of that fecal contamination in his food or a person-to-person contact, there can be contamination. He can contaminate any kind of food or water or even the things that he uses. And because of that, if any other person touches those things, then the other person, when he uses his fingers or whatever the materials that are infected, and he eats, then he'll get an infection. So it is basically through the ingestion. It can be through the food or water. And there are so many other scenarios, like your water that you get in your house for drinking purposes. It can be contaminated because there was a pipe which was broken, and the sewage pipe usually runs below the fresh water. Okay, if there is leakage of pipes over there, then it can get contaminated. This contaminated water will go into your house, and then the RO purifier that you are using, it will cross that also. And sometimes even if you have UV, that also it can cross and come into your food. Or sometimes there are so many unhygienic places that you eat from where you can get the infection. Now the symptoms for hepatitis A, B, C, D and E, they are usually common. That includes fatigue, sudden nausea, vomiting, there can be fever, abdominal pain. One common thing is clay-colored or pale stools. The jaundice, it might be there for some people, especially in hepatitis A. Mostly the cases that we don't see, they are called subclinical cases. When we say subclinical cases, that means there are no symptoms. People don't come up to you, but still they have this infection inside them. The virus is still there in the infection in the body, and it is still the patient is still delivering the virus through his stools. So if there is any contamination around that, then there is a good chance that the drinking water or the food that we eat, it can get contaminated. Especially people grow, if you go around the country, people grow vegetables in sewage water. Now, if you don't wash them properly, then there is a chance that it is contaminated with hepatitis A. Now, these symptoms, you have to understand, these are common. But for hepatitis A, the symptoms can be very low, but it is there throughout. So how do we identify or how do we diagnose hepatitis A? So when the person comes with these kind of symptoms, we assume that it might be a case of jaundice because of hepatitis. So when we do investigations, now for hepatitis A, there is IgG, that is immunoglobulin G, that we check, that shows that there is a past infection. And for present infection, we can do a RT-PCR. You are all aware of RT-PCR, especially during COVID. Now during COVID, we have done RT-PCR that can be used for so many other infections. It has been there previously also, but we are, as general population, we are only aware of it after COVID. So RT-PCR gives you what kind of infection it is. Coming to the prevention part, as I said, the source of infection is a person. It can survive outside the person also for quite some time. Now, what happens when you ingest those contaminated food or water? For around 2 weeks, you'll not be having any symptoms. But after 2 weeks, you'll start having these symptoms. But sometimes, as I told, there will be subclinical cases where there will be no symptoms. So you should be aware that if these symptoms come, you should go to a doctor, visit a doctor. And now for hepatitis A, the treatment part, there is no treatment for it. It is basically symptomatic, and it is supportive treatment that we give. There is no specific treatment for hepatitis, except for hepatitis B, which is also not that effective, but otherwise there is no treatment, it is supportive treatment. But what can you do best to prevent having these infections? For hepatitis A, there is a vaccine which is available, which you can take, especially if you are traveling to those places you think that which are unhygienic or the prevalence of hepatitis A is high. You can take this medication or this vaccination. And it is also given in high-risk groups. Who are the high-risk groups for hepatitis A? People constantly eating around, traveling to various places around the country, traveling to rural areas, eating outside in places which are unhygienic. They can take this vaccination. They are the high-risk people. But if you don't have those kind of high risk involved, or if you are particular about eating at home or at a good joint, then the risk is very less. But the best thing about hepatitis A and E is that it is food and waterborne, and it is not chronic disease. It is acute. It stays for some time, maybe less than 6 months, and then it wanes off. But the antibodies for hepatitis A, they remain throughout, and it gives some kind of protection for the next infection. It doesn't mean that you'll not have hepatitis A infection again. It means that you have some kind of protection. But when your immunity goes low, when your immunity reduces, especially in times of pregnancy, or if you have cancer, or if you have any chronic diseases like HIV, then your immunity is low. In that case, again, you can get hepatitis A if you are in contact with hepatitis A virus. So the important part is that we have to prevent it. Instead of going through the suffering, we have to prevent it. So wash your hands properly while you are eating. Cook properly. Even at 100 degrees Celsius, virus can stay for some time. That is around 10 to 15 minutes. At 60 degrees Celsius, it can stay alive for around 1 hour. So make sure that you cook properly, wash it properly. The food safety is very important. The drinking water, again, especially during the monsoons, the water is contaminated. And during summers, the availability of water is very less, due to which the contamination is again high. And the amount of water when water is less is huge. So even during that time, the best thing that you can do is boil the water and cool it down and then drink. UV has protection. UV rays give protection against hepatitis A, but sometimes even when your system is not working properly, which you are not aware of whether it is working properly, so you have to maintain your aqua purifier which has UV in it properly. You have to go through annual maintenance of your aqua purifiers. Then sanitary waste management. Now this usually happens where the pipes are old. The municipality has laid down pipes some 20-30 years ago, which are lead pipes or iron pipes, and they after a few years go through rusting and corrosion and they leak. So when it comes in contact with sewage water, it gets contaminated. Now coming to hepatitis B, it is very important that you know about hepatitis B and C, because the complications due to hepatitis B and C are very huge. And it is a big burden not only to you but to your family, and it is as good as HIV if you have a chronic hepatitis B infection or C infection. Now why is it very important? Even though it is a DNA virus, other viruses in hepatitis are RNA viruses, so it doesn't matter, but the function of hepatitis B is different. And how does it happen? How do you acquire hepatitis B infection? It can be through various fluids in the body. It can be through your blood, it can be through your cerebrospinal fluid, it can be through your mucous membrane, it can be through your seminal fluid, it can be through your vaginal fluid, and it can transfer from mother to child. Now, where can we prevent it? And how do we go about not getting an hepatitis B infection? Now, hepatitis B infection, it has, when I spoke about hepatitis A, I told that after 14 to 28 days of acquiring the virus, you can get the symptoms. But in case of hepatitis B, it is 1 to 6 months. That is, if today you have the virus has entered into your body, it will take around 1 to 6 months to actually show any kind of symptoms. So for 6 months, you are not aware that you have an infection. And during this period, you can transfer it to anybody. That is called incubation period. That is, it is incubating in your body. And during this period, there is a high chance that it can transfer it to your spouse. If you are donating blood, you can transfer it to people who are receiving that blood. So it is very important that you know about this disease and about this virus. As I said, the symptoms are same for all the hepatitis: fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, clay-colored or pale-colored stools. These are all common, along with jaundice. Now, you actually notice it when you get jaundice, because the other symptoms are similar to so many other diseases. So by the time you get jaundice, there is actually inflammation of your liver, and liver has completely gone wrong, because of which there is so much of total bilirubin that is being produced, because of which you get jaundice. Now these are the symptoms. As I told, the causes. So now the prevention is based on what were the causes for hepatitis B infection. The prevention includes when you're getting blood donation, or when you're a recipient of blood. Obviously, the blood banks make sure that you don't have hepatitis B, HIV infection, and other kind of infection like malaria. But when you're donating, make sure that if you are hepatitis B, please do not donate blood. Even though the blood bank checks for hepatitis B infection, presence of hepatitis B particles in the blood, but if you are aware of it, please do not donate. Second thing, even it can be seen in IV drug users. It is very common because it is similar to HIV. So it can be transferred through blood. So if you are an IV drug user, make sure that you do not exchange needles. Practice safe injectable uses. And these injection practices, that is for every time you use injection, buy a new syringe. Even for HIV, this is followed. And safe sex practices. Use a barrier method, that is use condom if you are aware that you are hepatitis B positive. And this is for lifelong. And if you are put on medication for this, you have to take it lifelong. Now the treatment, there are few antivirals like tenofovir that is being used for this. This has some kind of protection. Basically, it reduces the viral load in the body, and because of which chances of transmission are less. And are there any vaccines for this? Yes, even government provides this free vaccines for these, and otherwise also you can take these vaccines from outside. Now, what is the schedule for this, and how do you go about hepatitis B vaccination? Now, the government says at birth you have to get hepatitis B along with oral polio and vitamin K. At birth, it is given again at 6 weeks and 14 weeks, 10, 14 weeks. So there are 4 doses at birth, 6, 10, 14 weeks. Hepatitis B is given. But for an adult, if you are not vaccinated for hepatitis B, you can take today followed by 1 month and then at 6 months. That is 3 doses. Now there are a few controversies that if you do you need a booster for this or not. You can take a booster after 5 years. But the amount of protection that is given by these vaccinations is around 95%. That is, there is a 95% chance that you don't get hepatitis B infection if you are vaccinated with hepatitis B. So make sure that if you are at high risk and if you are aware, you follow these protocols. That is, you take your vaccination and make sure that you do not bleed and make sure that you follow safe sex practices. Now, hepatitis B and C, they are similar. What are the other things or other complications that hepatitis B and C can cause? These are called chronic diseases. What do you mean by chronic? Chronic is if the infection lasts or if they are found positive even after 6 months of infection, then it is called chronic. Now, these hepatitis B and C, they are known for chronicity. That means they can be there throughout the life and they can cause complications like cirrhosis of liver. If you have heard about cirrhosis of liver, even heavy drinking alcohol can cause cirrhosis of liver. And most common cause of hepatic cancer, that is liver cancer, is again because of hepatitis B and C. Among hepatitis B and C, it is hepatitis B because the infections, number of infections due to hepatitis B is high. That is why the number of cancer due to hepatitis B is high. Otherwise, hepatitis C is more common for cancer. Coming to hepatitis C, as I said, it is similar to hepatitis B. There is no vaccination for hepatitis C. Otherwise, it is similar to hepatitis B. And it is more prone for chronicity. Again, the transmission, the causes are similar to hepatitis B. You need to practice same kind of preventive measures for hepatitis C also. Now, coming to hepatitis D, in order to survive in the body, it needs hepatitis B. So if you have hepatitis B, then hepatitis D superinfection can happen. Now, if there are 2 viruses, different viruses, that is hepatitis B and D are there, then the complications are again high. Now, the preventive measures are similar to hepatitis B and C for hepatitis D also. Now, coming to hepatitis E is similar to hepatitis A. That is, route of transmission is same. You need a fecal-oral route. That is, there should be a contamination because of your fecus, stools contaminating your food or water. Now, the prevention for hepatitis E is similar to hepatitis A, but there is no vaccination for hepatitis E. You need to understand that the vaccines, how they are produced, I'll tell you. The vaccines are produced based on what is the prevalence of a disease. The infection rate or the prevalence of hepatitis A and B are high in the population. That is why all these pharma industries have developed vaccine for that, because they'll get more volume of vaccine to sell. Okay. Otherwise, there are so many other infections which are as good as hepatitis B or A, but they cause similar kind of complications and morbidity and mortality, but they are very less. So hepatitis E is one of that. The symptoms compared to hepatitis A, the symptoms due to hepatitis E can be less, and it will subside by itself. Now, coming to all these, when I said how do you diagnose, what kind of test do you do for diagnosing hepatitis? Hepatitis A, as I told, it is RT-PCR which confirms. But when it comes to hepatitis B, there are tests like HBsAg. Okay, HBsAg is basically we check for surface antigen of the virus particle. If it comes positive, that it means that you have been infected with hepatitis B. Now, there are quite other tests like anti-HBsAg, which says that there are antibodies to that antigen. Now, there is something called HBeAg, which says that virus is actively replicating in your body. That means you are highly infective. If any of your body fluids are transferred to anybody, they can be easily infected. So there are different tests available for this. But the prevention part, you should understand, hepatitis A and E are different, and B, C, D are different. And you should understand that hepatitis B and C are the most severe form of hepatitis, because they can cause cancer, they can cause cirrhosis of liver, and they are there for a longer duration of time. Now, the conversion from acute, that is lasting for less than 6 months to more than 6 months, is there, but people can recover within 6 months only. But it doesn't mean that virus is completely off your body. You need to understand that there is chances of getting it into chronicity, but there is also chance of not going into chronicity and recovering from it. But once you are chronic, if you are more than 6 months infected with hepatitis B or C, then make sure that you are at most physically fit, leading active, healthy lifestyle, and practicing all the preventive measures in order to not transfer it to your family. Even in family, it doesn't mean only spouse, even to your kids. If there are any ulcers, or if you have an abrasion, if there is a blood coming out of your small injuries, and if somebody in order to stop, as we see in our Indian movies, right? If there is a bleeding, what do? You put the finger in your mouth, right, to stop the bleeding. So if you do such kind of things, there is a chances that hepatitis B can enter your body. So it can transfer to even people who are in close contact with you. So for them, is there a treatment? Yes. Make sure that they get the vaccination. Make sure that they get, even after infection, after doing such kind of acts, you think that there might be a chance that it might be transferred to the children or your spouse. There is a treatment called hepatitis VU immunoglobulin, which can prevent actually having an infection of hepatitis B in those contacts. So make sure that they are vaccinated, first of all, if they are at risk. Especially if you are hepatitis B, make sure that they are vaccinated for hepatitis B even before any kind of transmission happens, so that they do not get the infection. So myths and misconceptions. What are the myths that are commonly there? So if I don't have symptoms, I am not infected. Is it right? No. Even if you do not have symptoms, as I said, there are so many subclinical cases. People who do not have any kind of symptoms, but the virus is still there in their body, and they are actively replicating. There is a huge chance, there is a definite chance that they can transfer. It can be hepatitis A, B, C, D, E, whatever. Even people can be without symptoms, but the virus is actively replicating in your body. Second, if I don't have symptoms, I can't spread that virus out to others. No. If you don't have symptoms, even if you don't have symptoms, there is something called incubation period, where the virus lies silently in your body and you are still spreading or shredding the virus, and it is being contaminated through food, or if you are not practicing any kind of preventive measures when you are hepatitis B or C infected, then they can easily be transmitted to the person that you come in contact with. If I have been infected with HBV in the past, can I get it again? Yes. Hepatitis A, even though it provides long-lasting immunity, you can get the reinfection again. But hepatitis B and C, as I said, it can last more than 6 months, and that is when we say chronic hepatitis B, and they remain infected throughout their life. It is like HIV itself, which you do not have cure for. It means that it is chronicity. Can you be infected again? Yes, with hepatitis A or E or B and C, it is basically the chronicity that continues. Now, there is one more thing that I forgot to tell, especially from mother to child. So, mother to child, you have to prevent, that is even before mother gets pregnant, everyone should get vaccinated with hepatitis B, so that this transmission, if you are having hepatitis B, it can be prevented from the child having it. That is why every newborn baby in India is being given hepatitis B along with oral polio vaccine, so that they do not get this infection, or they, even if they have those antibodies in the body, they are protected with vaccination. Now, there is a chance that these infections, especially in childhood, especially newborns and children up to 1 year age, infants, they do not have that kind of immunity in them to actually develop these diseases, develop antibodies for these diseases. That is why the vaccination for hepatitis A is recommended only after 1 year. In case of children, it is recommended at birth, that is birth and 6 weeks, 10 and 14 weeks. It is given as a part of pentavalent vaccine, 6, 10, 14. But at birth, hepatitis B is given separately. Finally, what I would say is, like we have listened or we have heard throughout our childhood and even in adulthood, prevention is better than cure. So make sure that, like hepatitis A and E, make sure that you practice good hygiene practices, like washing your hands, washing the vegetables, keeping everything healthy, that is your water, food. Make sure that you get food from good places, and make sure that you eat right. In case of hepatitis B, as I said, it transmits through blood and semen, vaginal fluid, all kinds of your body fluids. So make sure that you, if you are aware, be responsible. If you are positive for hepatitis B, be responsible yourself first. Make sure that it is not transmitted to other people whom you love, especially your close contacts. As I said, prevention is better than cure. So follow these things. And if you see, always prevention is better than cure. And instead of going through the entire process of getting an infection, it is better that you prevent it. And somebody said that immunity is, how do you improve your immunity? As I said, have a healthy lifestyle. Thank you.
Someone wants to know, if the CD4 count is above 800, does that mean they also have HIV patients? Sorry, let me just repeat.
CD4 count is not for HIV. If you are particularly talking, is it about HIV?
Yeah. So does then, like, I think he wants to know if this is at risk of hepatitis A.
See, CD4 count less than 200, you are at risk. If CD4 count is more than 400, less than 400, you are at risk. But the risk varies. Okay, it increases as the CD4 count increases, the risk decreases. Okay, it is vice versa. That if your CD4 count is low, the risk is high. But CD4 count of 800, the risk will be little less. But there is risk compared to normal people.
So one was, how long does the vaccine last?
See, as of now, for the Indian community, according to the data, it can last till 15 to 20 years. But you have to understand that research is available only for 15 to 20 years. The initial research which was started on these people, it is still going on. So there will be further, after 25 years, again they will be checking these people for presence of antibodies. So it might extend it to 25 to 30 years. But when it comes to hepatitis A, the antibodies they last for lifelong. Okay, that 5% is not a lot. It is fine. 95% you are being protected. That 5%, it might be due to various factors. Now I'll tell you what are those factors. Especially during vaccination, if your immunity is low, that means that the amount of antibodies that are being produced for that B or A is weak. So sufficient amount of antibodies are not produced. So make sure that you are healthy when you are being vaccinated. That means your immunity is fine when you are being vaccinated. Don't get it vaccinated when you have fever, when you are pregnant. Okay. Then is queer community more prone to? Yes. The queer community is more prone, especially when I said there are high risk people. Now the high risk people can be frequent blood donors. Now the other high risk people can be people who are into prostitution. The other high risk people can be people with multiple sexual partners. Now, other people can be IV drug users. Then coming to your people who are into oral sex or anal sex. So yes, queer community is at high risk. So make sure that you practice safe sex practices.
So the next question is TLD reduces viral load within a year. Does a similar medicine exists for hepatitis B?
No, hepatitis B, there is something like antiviral, like tenofovir, that gives you some kind of protection, and the side effects are also less. So if you are prescribed tenofovir or any kind of antivirals, please take them. Okay, it reduces the viral load. Like in HIV, there are we do not have a cure here also, but they reduces the viral load. Similarly, here also they reduce the viral load. So the chance of transmission are less.
He's asking what is the time duration.
See, there is no time duration. It is very subjective. Now, when I say subjective, it is basically depends on the immunity of the person. So if you are good, your immunity is better, then the viral load will reduce. But then there is chances of so many other infections that you can occur. Like you asked CD count, somebody asked CD count. If it is less, that means that your immunity is less. That means the chances of virus replicating is high.
Can hepatitis B transfer through saliva? You said blood from finger in contact via saliva can cause it.
No, it is not through saliva. Saliva it can't. When there are ulcers in your mouth, okay, if you have very thin membrane, there are ulcers, there are some kind of lesions in your mouth, the absorption rate in the mouth is very high. So what happens? The virus will get easily into the blood circulation. That is when it can happen.
How to get better immunity?
You see, better immunity, it is you have to stay healthy. Okay, there are so many lifestyle modifications so that you do not fall ill. That is one thing. That is like being active, physically active, go for a lifestyle modification, do not drink, do not smoke. These are all general things. But then you have to identify those lifestyle modifications which actually, if you are obese, try to reduce your weight. If you are not active, if you are leading a sedentary lifestyle, make sure that walk frequently or do some kind of physical activity. Third, if you are diabetic, make sure that your blood sugar levels are under control. If you are hypertensive, be sure that you are on medication and make sure that hypertension is under control. And like eat proper. When I say eat proper, make sure that you don't eat all kind of junk food, which doesn't provide anything other than calories. Did not give you any kind of antioxidant. It did not give you any kind of fibers. Okay, they did not give you any kind of vitamins. They are just providing you calories, which are basically being stored in your body as fats. These are general things that you are aware. Only thing is you do not follow those. So make sure that you follow those. Eat right. At least eat one portion of fruits in a day and 2 portions of vegetables in a day. Now, these are the right things. Now, there are also other things that we need to talk about. Make sure that you get annual health checkup every year. Make sure that all your parameters are normal. Make sure that if you are having any kind of family risk, do not fall into that category or you do not get that disease. So in order to prevent that, you have to screen them properly. I'm not saying immunity can be reduced due to various diseases, especially non-communicable diseases. That is like diabetes, hypertension. They lower your immunity. So make sure that all the things that you are doing are right.
Is LFT liver function test recommended every 6 months?
See, initially it might be recommended every 6 months, but otherwise we can then shift to 1 year.
I have dealt with a case where the person has a hepatitis B from their mother. So their viral load came down to like a normal after 23 years. Like now they are 23 years old. I also have a person who has HIV and their viral load reduced to less than 40 within 6 months of medication. So my question is why is there such a disparity? I don't have much history of hepatitis B, but I do have I know a person having HIV very well. So I don't know why this why the viral load took 23 years for the hepatitis B and just 6 months for HIV. So can you shed some light on that, please?
Yeah, I can't be specific. I have to give some facts here. First of all, when you come to any kind of disease in the medical branch, we do not actually know the entire natural history of any disease. But since we do interventions, what we know based on different kinds of research is somebody, especially when you said 23 years, right? It took 23 years. Let's assume that they have been vaccinated. Now the other question is, have they been getting this tested every year?
Yeah, I'm sure they were getting the viral load tested every year.
So it doesn't matter. It can take 23 years or it can reappear again. So since there has been already an infection before, like I said, more than 6 months, it is considered as chronicity. It is. I mean, there is a good chance that the chances of getting cirrhosis or liver cancer is high in them. Okay.
Good.
This is what the research says. But the research that has been mostly done is among people from Western countries. Now, there are researches being done for Indian population also. It might vary, but we do not have the reports as of now. Okay, now I'll tell you one more thing. The chances of children having this disease that is turning into chronicity is high. Why? Because initially the immunity is low. So if they have got this hepatitis B infection at birth, during that time their immunity is very low. That is why it will grow into chronicity and it will last for longer duration. Now, hepatitis B in adults, if they get this infection during their adulthood, the chances of actually getting initially the infection becoming positive is less. But once they get it, the chances of going into chronicity is high. Understood?
Yeah.
So if in your childhood, they can grow to chronicity easily. But if you get it in adulthood, the chance of going into chronicity is less. But if they go into chronicity, the ultimate end, that is developing a cancer or having cirrhosis and the death due to that is high.
Sir, just one short question. I would like to rephrase it. Like, suppose there are two people of say 20 years old, and both of them, one have HIV, one has hepatitis B, and both are put on ART. So, which medication is more effective? Like the viral load of HIV, I have seen it getting reduced to undetectable in less than 6 months. Does it holds true for the medication of hepatitis B as well?
No. Now, only thing is we have very less number of medications in hepatitis compared to ART. ART, there are actually newer medicines that are coming in. And the combination of medicines, the people are still trying out. So we are having the therapeutic recommendations, they keep on changing. There is better control in HIV than hepatitis B.
Thank you so much.